All right, when you're working on integrating big muscular and sensory reflexes like an ATNR or a STNR, really there's multiple layers of integration and inhibition. The number one, we're really trying to activate the weaker cerebellum and the weaker cortex. So there's multiple different ways you can do that. You can do that with sensory therapies, with photobiomodulation, which is a very powerful way to work on these reflexes. We're going to kind of layer these and show you how we start a session or how we work on integration and inhibition of these two reflexes specifically. So ATNR and STNR. So with Mr. Taylor here, I've got him set up. So let's say he is a left cortex weak and a right cerebellum weak. So you could have your therapist or staff holding the lasers for you, but if you don't have them, then you can use the stands and just line these up. Some kids are going to be obviously a lot more compliant with this than others. Some kids are going to be a lot more hyperactive. If you have a hyperactive child, it makes a lot of sense to have staff being the ones holding the laser. If you have a child that can regulate and stay calm and stay in one spot, then the laser stands are very helpful in spreading out your staff and allowing you to see more people simultaneously. But in this case, since Mr. Taylor, he can regulate, he can be still, we're going to demo how to use the lasers and do some therapy simultaneous, just like a one-person operation or a one-person staff or a single doctor or a single therapist. So number one, activating and promoting activity in the weak cerebellum and the weak cortex. So we can do that with sensory therapies on the right side of his body. So I could have a ResiMax or a vibration device on his right limbs in this case. And when I'm working on his right limbs, obviously I'm creating activity in that right cerebellum. That's firing up to his to his left motor cortex. That motor cortex is your sensory and, your parietal, which is more sensory, and then that motor area is a lot more frontal lobe. So when I have the laser on this area, I'm going to straddle that somatosensory and somatomotor cortex with the laser. And when we're using lasers to integrate reflexes, having multiple wavelengths and using multiple wavelengths within a single session is extremely powerful. So in this case, I've got an Avant Revi and I've got an Avant LZ30. So I have 3 wavelengths of photobiomodulation here. So the Revi having violet and red, and then the LZ30 having infrared and red. And when we do work on reflex integration, strengthening cortical function, all 3 of those wavelengths are incredibly powerful and incredibly valuable. So when you're working on these therapies, using all 3 within that same session goes a long ways. Some kids you'll find respond much better than other kids in certain wavelengths. So just for example, I had a child last week that did really well with infrared. So throughout the week we used all 3, but our focus was probably infrared. And today we had a boy that just had like really no ability to regulate, no ability to stay calm. And he really responded well when we had the violet. So when we were on violet on his cerebellum or his frontal lobes, he was regulating very, very well. So being able to use all 3 is very beneficial, but some kids will benefit from certain wavelengths more than others. So use your clinical judgment, evaluate their reflexes, see how their eyes are moving, keep an eye on their demeanor and their ability to stay calm and stay put, and then you can focus your efforts and your time using the wavelength that's most beneficial. In general, we want to use all 3 because they're all penetrating at different depths, providing different amount of energy at different depths, targeting different cells in different ways. So violet's really good for immune modulation, toxic exposure, mold, infections, where red is just like steady Eddie. It provides a lot of energy. It really floods and saturates the tissue, where infrared goes very deep. So we have multiple benefits of the multiple wavelengths. So I'll leave the lasers off while we're working on Mr. Taylor here. But if we have the stands, very beneficial. If a kid's moving all over the place, you're probably going to need an extra set of hands. If you're by yourself and you have a really hyperactive kid, and you should do the lasers before you do any stimulation. So give the brain energy, calm inflammation, increase activity in the brain, and then work on your activities. And so you can kind of go back and forth between photobiomodulation, activity, stimulus, photobiomodulation, activity, stimulus. But if you're working with staff, or you have a kid that can stay put, you can work on a lot of things simultaneous. So if I was working on integration of an ATNR with Mr. Taylor, we could work on right body movements to strengthen his weak cortex. A lot of times if you strengthen the weaker cortex, the cortex comes down and inhibits the reflexes. I was just in an exam yesterday with Dr. Josh, and he lasered a little girl's right frontal and left cerebellum and immediately got rid of her ATNR and STNR. So sometimes it can be that easy just by providing enough energy to the brain to create activity in the brain, where the brain then comes down and inhibits those reflexes. So make sure you're checking which wavelengths are beneficial. Make sure you're not leaving out laser if you can use it or if it's within your scope. But in this case, if I'm trying to strengthen Mr. Taylor's left cortex, I'm going to work a lot on right body stimulation. So what we can do with this is I can actually have him rotate to his left. So if we're working on an asymmetrical tonic neck reflex, I can have the patient actually rotate away from the side I'm working on. So best case scenario is if that patient is rotated away and they're cognitive and aware of what I'm doing. So when I'm working on a kid's arm, I'm going to say, hey buddy, or hey, try to make this arm like a noodle. Try to keep it as relaxed and as still as possible. Let's go legs straight, Mr. Taylor. And in this case, what I want to do is have like a really soft grip. And we have a great training video that we did over our staff training about range of motion. I'm going to make it a little bit more specific here for an asymmetrical tonic neck reflex. So while Mr. Taylor is rotated to his left, I'm going to work on right body stimulation and right body range of motion. So if a kid has an ATNR with left cervical rotation, with that, what they're going to do is they're going to fire all these flexor muscles on their right side. So what I'm going to do is I'm going to put them in that position, but then work on smoothing out and differentiating all those different joints, all the different muscle groups within his arm in that cervical position. So if a kid can be aware and cognitive of what's going on, that's ideal. Like body aware, thinking, feeling, when they are consciously and subconsciously balancing their tone, that's best case scenario. If a kid is much less stable, or if you have like a really hyperactive kid, you can even like have a therapist over there, or put some toys over there, or worst case scenario, put on like a low stimulating show or some sort of visual input that keeps their attention focused that way. And we do that quite a bit here, especially with like our kids that are really autistic, or kids that just can't stay put. We'll use something low stimulating, put their field of view over there, put it put it onto their left, so they're turning to their left and working on the other opposite side of body. So while we're working on right body rotation, right body range of motion, what I want to start with is, in general, I look for the most proximal joint first. So when we're working on range of motion, developmentally, I want to work on that motion in the same sequence that we develop. So babies will learn how to use their shoulder. They'll develop that intermediate cerebellum before they develop their lateral cerebellum. So when I'm working on shoulder movements, I'm starting to provide energy and activity to that intermediate cerebellum. You'll see that weak with like arms extended, alternation of arms. A lot of kids have really bad issues there. Instability, gait changes. Like there's a lot of things that intermediate cerebellum helps us coordinate. But in this case, I'm going to work on just priming those joints with the most proximal joint first. So in this case, a shoulder. So while he's turning to his left, I'm working on some gentle shoulder range of motion. And one thing that you'll note is I'll have really soft grip here, so my hands are just gently, essentially like gravity is keeping him in my grasp, and I'm not holding on to him firmly. Kids will match your tone. So if you have a soft grip, they're gonna relax, and that's really what we want here, is a child to really relax and be able to move through these ranges smoothly. So I'm always thinking of small and then progressively larger, but always slow ranges of motion. And one thing you'll notice is while you're doing this, like even while you're moving a shoulder, you're gonna feel a wrist kind of flick or twist, or you'll feel their bicep will engage. You'll feel some abnormal and reflexive flexor tone. And with that, what we want to do is try to find those areas where that child or that individual creates those abnormal tones, and we want to work around them with different joint angles. So if I'm working on Mr. Taylor's arm, and right there I feel his wrist kind of extend or flex, what I want to do is kind of find those spots and then really slowly work through them. Or I might change some joint angle. So I might change the angle of his shoulder and see if that same movement elicits that reflexive tone. Or I might change the joint that I'm working on. So you really got to find your window in. Some kids, you can start more proximal and work distal. Some kids, they aren't ready for that bigger stimulus yet, so you might want to start more distal and then work proximal. So even sometimes working on this finger ranges of motion, so complex movements through the finger, and then you get to the hand, and then the wrist, and then you can start to tie in the elbow, or you can work your way from the shoulder to the elbow, wrist, and then fingertips. So kind of find what helps that child the most, and whatever helps that child the most is what's going to make it smoother. So be really aware with your hands. So this isn't me just doing figure eights and kind of going through the motion, talking. Whenever I have a therapist in the room, I want that therapist to engage the child if they're lasering, and I want to be really cognitive, and I want to be really aware of what I'm feeling, because it's really subtle. So when you're moving these kids' arms, or these children's arms, and you feel something that's reflexive, that's telling to you. So you really want to pay attention to your hands, even looking with your eyes to see if there's any other reflexive movement throughout their body. So if I move his arm, do his feet twitch, or does his head kind of move? And so just really be aware of those things. So when I'm working on strengthening this right cerebellum and that left cortex, all of this proprioception, all this joint position sense is really providing a lot of information to the brain. And the more information we can get to the brain, the more the brain can then differentiate those different joints, differentiate those different motor patterns, and create a more proper and accurate output. So when kids have inflammation in their brain, or they have underdevelopment of their topographical maps, if things fire together and they've wired together for years, reflexes are strong, being able to separate those movements through really slow, gentle ranges of motion and complement that therapy with photobiomodulation, a lot of times can knock out reflexes in a day or two. Sometimes it can even be 10 minutes for some kids. It really depends. But the two together provide a really powerful therapy for reflex integration and inhibition. So if I'm working on the arm, figure eights through the shoulder, then I can add I can add elbow movement, so I can go supination and pronation while doing some figure eights through the shoulder. I could even tie in a little bit of extension and flexion while doing figure eights through that shoulder still. And then I can also tie in some wrist movements. Sometimes you'll find that kids do really well when you add more sensory input to the system. So layering this by maybe having a Resimax on their elbow, or a vibration device on their elbow, or holding vibration devices on their shoulder, or on their wrist or their hand. And adding more input sometimes makes their movement much smoother. Sometimes it makes it a whole lot worse. So really be aware of what you're feeling before and after. Troubleshoot, find your window in. Sometimes it's proximal to distal, sometimes it's distal to proximal. If you're able to tie in head rotation, you can really make a lot of progress in an asymmetrical tonic neck reflex. If I'm gonna move down here, with an ATNR, you're also gonna have lower body flexion. So what I wanna do is really work on the hip also. So we showed this in the video. Again, same points here. I'll kind of line the laser up. So if I'm working on the leg, I always wanna have my laser and my photons go into the part of the brain that perceives and controls the leg. So in this case, lateral cerebellum, and then the superior motor cortex, just parasagittal, so just off of midline. So providing energy to this area, working on the lower limb. So again, I can start with some sensory stimulation like Resimax, just to kind of prime these areas. Then I can start to do some range of motion activities. So in this case, if I'm working on the hip, again, like the video, the training, I can work on some really slow, subtle figure eights through the right hip. So I'm asking the patient to say, hey, like pretend your leg's a noodle, or pretend your leg is so sleepy, or or it's a string, or try to keep it so still. I just kind of give them cues and meet them where they're at developmentally, just to try to get them to relax. A lot of times if you're able to layer these therapies with like some cognitive tasks, like play like thinking of an animal, or some guessing games, or telling stories, or if I'm by myself, I'll just ask some like questions, like open-ended questions that the child can then kind of elaborate on. Like, hey, tell me about like your favorite thing to learn about, or tell me about your favorite food. And them, when they're thinking, a lot of times they're going to let their body relax. If they're reaching and trying to get up the whole time, it's going to make it a whole lot less productive. So the more you can engage them and interact with them without distracting from what you're doing is going to be really powerful. So working on the hip, I showed some figure eights there, so we can maintain those figure eights through the hip, and then we can also tie in some knee flexion and some knee extension. And if the hip is reflexive, I'm going to stay on the hip until it's smooth. If the hip is reflexive and you start adding more complexity and more movement to that, a lot of times it makes it a lot worse. But maintaining smoothness throughout all of these is really critical. And with kids, it's really easy. You can just use like 2 fingers to do the work. With Mr. Taylor, he's a tall guy here, so I can get away with maybe a couple fingers on each hand, but again, your grip is really light, complex movements through the hip, then the knee, and then you can start to tie in the ankle, okay? Really powerful for integration of an asymmetric tonic neck reflex. If it's bilateral, by all means you could work on the other side. I would spend more time working on the sides that are going to stimulate and promote activity in that weaker cerebellum and the weaker cortex, okay?
Thanks for taking the time to check out this video. To learn more or to schedule an intensive or anything with my team, there's a link below. Just go ahead and click that and that'll get you to the right spot. Have an awesome day.